Warriors. I am so glad you're listening in. I have the greatest guest for us today. I learned so much and I so loved connecting with her. Dr. Amy Duffy is on the show. She is the author of the #1 international best-selling book, Normal Doesn't Have Side Effects. She's an award-winning speaker at Harvard Club of Boston. She's been featured on NASDAQ, New York City Bar Association, CNN Center. She's a frequent guest on ABC, NBC, CBS, Fox Network, TV news, and talk shows. And now she's on the Love Your Life show talking to us about all things female health, inflammation, fatigue, menopause, perimenopause. Do not miss this one. Actually, grab your warrior notebooks and a pen because you're going to want to take notes. And then head to Instagram and head to her website to just let her know how much you appreciated her sharing her time with us. Thank you. Let's go. Hello, Dr. Duffy, and welcome to the Love Your Life show.
Hey, thank you so much for having me. This is awesome.
Oh, I'm so glad. I'm so glad to have you here. I was just saying how I get constant questions from women like, am I crazy? Am I going, like what's happening to me? And I just love having you on the show for that, but also because I feel that our work really is in alignment. Like I love how a lot of what you do is encouraging people not to accept average or normal.
Yeah,
And as a life
exactly.
coach, that's what I feel my work is too, that there doesn't need to be a problem to come to see me. Like you come
Yeah.
on in and it's proactive. Let's proactively address your mental and emotional health. And then you're
Yes.
proactively addressing physical health. So how do you get people like how do you get people to that, like not waiting until there's an illness to get started?
It really depends on the message. I mean, I would say a majority of people that come to me are having a symptom of some sort. And um, hopefully we're catching it in the symptom phase before it gets into something that's, uncontrollable, if you want to call it, or, something where some serious damage has been done. But I think what the frustration that we get from a lot of people is they feel bad, but yet they go to traditional medicine and nothing's wrong with them, right? So they don't have the disease yet. There's nothing really obviously wrong yet, in their brain they're going, this is not who I am. I don't this body doesn't feel like my body. Something's not quite
Mhm.
right, right? So we tend to talk more about, how do we get back to a place that is optimal, a place that, feels good, where you're not just surviving through your days, but you're living your life, which is, all about what we're talking about, right?
Oh my God, yeah. That's I think I like started, I had some free giveaway that was like, stop surviving your days, let's thrive.
Yeah.
And
Yeah.
that idea. And I really appreciate you speaking to the part of people feeling a little crazy. Like, but this isn't, I don't like feeling like this. And hearing from
Yeah.
doctors like it's fine, especially, I'd really like you to speak about hormonal and menopausal health
Right.
because that is, really starting, well, I'll ask you, but I feel like it's mid-30s where we're like, wait a minute, this doesn't seem
Yeah,
right.
we definitely start to see changes, and we can talk about what that means specifically. But I think, again, what happens is I hear this all the time too, especially if people aren't quite in what traditional menopause might be, age 50 plus or minus 5 years, which is, a huge range. But that they go and they say, hey, I think something's off with my hormones. Can we test them? And the doctors are like, why? If you're still having cycles, or, it's just going to be normal, and or there's no need to test. Let's just treat. And our choices are birth control, antidepressant, or another birth control, or whatever, right? So the issue is that they don't really need to test it, because the treatment is going to be the same for them. Like, it doesn't
Mhm.
change based on what the testing is, right? So I think that's where a lot of frustration comes from. Or, maybe I'm having a thyroid issue, right? And, I'm fatigued, I'm losing weight, I'm losing hair, I'm gaining weight, sorry, losing hair, that kind of stuff. It must be my thyroid because I've read about that. And then, they go test and thyroid is normal if they
Mhm.
do kind of the typical TSH testing. So, I think, just like you said, we definitely are starting to see changes early.
Mhm.
Um, and where does that come from? And because I've been doing this for so many years, and I do personally saliva testing for hormones, which also allows us to test for cortisol levels as well. So we see adrenal function, and that's like our stress hormone. And what I notice a lot in women that are, prior to menopause, it's actually the adrenal dysfunction and the low cortisol. Probably started out as high cortisol in the beginning when we, were being chased by this lion and we're running and everything's crazy. And then our adrenals are like, we weren't supposed to do this every day. And then they start to slow down. We actually have low cortisol. Cortisol and progesterone are right next to each other in the pathway. And so innately what happens is your body says, well, we need to survive before we procreate. So we're going to sacrifice progesterone to maintain cortisol levels. And so we start to see low progesterone happen earlier and earlier. So
Mm.
generally speaking, progesterone starts declining, naturally many years before menopause, up to 10 years even. And by the time you hit menopause, you've lost already 90% of your progesterone.
Mm.
And then menopause hits, which is actually the loss of estrogen.
Mhm.
So in menopause, or in this kind of perimenopause or premenopause, we lose progesterone. And progesterone is really our happy hormone. Like,
Mm.
that's the pregnancy hormone, right? And we're not looking for like pregnancy levels, but you hear a lot about women glow during pregnancy. Their hair's great. They feel good in the middle part. In the beginning, you feel blah. In the end, you feel huge. But that middle part of pregnancy where everything feels really good, right? Like, that's progesterone. It helps us sleep. It helps us calm down. It's kind of like a natural antidepressant. It's our happy hormone. It helps balance our weight. So low progesterone with normal or high levels of estrogen make us kind of gain that weight around the middle and that sort of thing. So that's where we start to really see those hormone changes happen even earlier, like you said, that mid 30s. Where is that coming from? And that's in when we talk about functional medicine or integrative medicine. Okay, we can measure it, we can see, and it helps people to understand, but understanding the why. So oftentimes, yes, we can replace progesterone and we have great results with that, but really we got to dig deeper and support what's going on at the stress level.
I mean, yeah, I did not, I just learned something and this is why I love having experts like you on. I did not realize that cortisol and progesterone were so closely linked. And that makes perfect sense to me then, that we would
Yeah,
see progesterone going down sooner, and even just with our culture that we're going to keep seeing that. And
right.
also how imperative it is for us to address not just the hormonal imbalance, but also lifestyle. So yeah,
And
so
that, I mean, when I talk about stress, there can be our external stress, which is,
Mhm.
alarm clocks are going off, my calendar's bleeping at me, I got kids everywhere, life coming at you, right? But then internal stressors. So what is our body being exposed to or experienced? And that goes down to our food, our choices in terms of what we're putting in. Um, if we're putting in food that's stressing out our system, right? So food can either be the best source of medicine or the slowest form of poison, sorry.
Mhm.
If we're just eating a bunch of junk and toxic foods and our body every day has to go, what is this? We need to put our barriers up and make sure we're protecting you, then that creates a lot of internal stress. So when we go back to lifestyle, it's not just, oh, I need to eat healthy to lose weight or less calories, less carbs, whatever. It's about, is this food going to fuel your body or is it going to create more stress internally as well?
Mm. Is this where inflammation comes in? I've heard
Oh,
you.
yeah.
Okay. Could you talk a little about that? 'Cause
So, I mean, when we're putting something in our body, right, and our body doesn't recognize it, initially it's going to send out some signals and, kind of put out the fire, if you want to call it. But what happens is we start to get this chronic reactivity, and it can either be what we call a histamine or an allergy reaction, or it can be an inflammatory reaction. And
Mm.
so often that inflammatory response is going to come from the gut reacting. And
Mm.
then you've heard the term leaky gut before. What happens is the barriers that we have that are there to protect us, we're all about protection. So inside, there's several layers of protection. One is our microbiome, or the good bacteria, right? And that can start to be eroded, if you want to call it, over time, because we're antibacterial hand sanitizer, antibacterial soaps everywhere. We got bleach in our water. So, if we're not eating dirt basically, or taking a good probiotic, then, we're knocking out our good bacteria. So that's
Mm.
layer one of protection. And then we have something that is called mucin, and that's like a really thick kind of Vaseline layer that's a really nice protectant. And over time, what happens is all this exposure to chemicals and things that our body's not used to, that layer gets eroded away as well. And so now we have like naked cells, and they don't know, they're not used to being touched by all this stuff. So all of a sudden they're being exposed and they kind of start to react. And
Mm.
then normally they're super tight together. We call those tight junctions. And because of the inflammatory response, they start to spread out. And now anything can come, from the colon or from the inside right into the bloodstream. The bloodstream's not used to seeing things the way that it's seeing it now. So even if it's something healthy like broccoli or spinach, because it's not being processed directly and then taken through the cell and, delivered appropriately, now it looks like some foreign body.
Mm.
That creates an inflammatory response. And then what your body does is that it's now on high alert. I kind of think about if your kids are playing those shoot 'em up video games, and
Mhm.
you're supposed to shoot the bad guys, but the good guy pops up and you're so hyper that you shoot your good guy too, right? And your body, that's what autoimmune disease is, or autoimmune reactions. And you can have these inflammatory responses before it ever gets to that disease state, right? So, you know, let's start to look at some of those symptoms that may be going on before we ever get there, because if we can start to heal the gut and reduce some of that reactivity that's happening, then we're going to see results, from a reduced inflammation standpoint. And
Mm.
the gut and the brain talk to each other. So one of the biggest symptoms we see is that fatigue, that irritability, that
Yeah.
I'm overwhelmed with everything. I don't, any little thing drives me crazy. That's a lot of common symptoms that we're seeing in women in this kind of menopause or perimenopausal place, right? And a lot of that just comes from, again, that adrenal dysfunction and stress, but the gut brain barrier is not happy. And
Mm.
that can create a lot of stress internally as well.
Oh my goodness. Yeah. And also like irritation. I mean, the ages that we're talking about for perimenopause and menopause, there's a lot going on that would make sense to irritate us.
Yeah,
So
exactly.
it's like, how do you know the difference as to whether it's,
Yeah, is this
like,
normal?
yeah, the kid asking you 15 times if he can go to the
Right.
party, or, you're,
That's true. I mean, we are, that's what it gets down to, is like, we've got this external world coming at us full force, and then we've got, the internal changes that are happening as well. And I always talk about really what I see in functional medicine. I liken it to a watering can. So if you're out here watering your plants, that watering can has the spout that comes out from the bottom. And as that water level rises, the water starts coming out, and the water coming out of that spout is our symptom. So whether
Mhm.
that's pain, irritability, hot flashes, night sweats, whatever. And traditional medicine is very much focused on the water coming out the spout. What
Mhm.
band-aid are we going to put on this? How are we going to block it, or catch it before it does something? Where if our approach is to lower the level of water inside the bucket, it's not going to come out in the first place.
Mm.
But realize that that level of water is multiple layers. And that's what I'm trying to get to, is that we're not going to have one aha moment of, oh, I can take this one supplement, or I can, do this one thing and everything's going to be better. It's often, unfortunately, a lot of stuff going together, but that
Yeah.
doesn't mean you can't start somewhere, and get some improvement. But a lot of our patients, we walk through an entire, wellness program that addresses the gut, the nutrition, the hormone balancing, lifestyle changes, stress management, movement,
Mm.
activity. We got to put it all together. And I'm
Mhm.
sure, in your life coaching, you're dabbling in the same areas, right?
Yeah. Yeah, it's really fascinating because it is that like we all want that magic pill, like the like, can we
Yeah,
just take, just tell me how much turmeric to take and then I'll be
right,
all okay,
right.
And it really is, it's like all the stuff we learned in kindergarten. It's like, oh my God, right. Like sleep matters, movement matters, like what we feed our body matters.
Yes.
Um, yeah, I really appreciate this. So what would be some more symptoms of like, I want to speak to the listener who's like, I'm not sure this is going on for me. I'm not sure if I'm just irritated because I have, teenagers or an aging
Right.
mother, or like, what are the symptoms that are starting to show us that maybe we're in perimenopause? Maybe this is hormonal. Maybe we want to reach out to someone like
I
you.
think, yeah, I mean, the most obvious symptoms are starting to be what I see first is night sweats. So
Mm,
before we get to the hot flash stage, we're seeing night sweats. Um, that's, the most, to me anyway, I'm saying obvious, like hormone driven symptom. That weight gain, that frustration of that, kind of belly fat not going away. And that can be progesterone driven or cortisol driven. So again, they're kind of next to each
yeah.
other. Um, and then we start to get that it's more fatigue. It's like it's like it's not the fatigue that I need to sleep all day kind of fatigue, but it's almost brain fatigue. It's like, oh, I just can't do one more thing. I can't think about one more thing, and that starts to get there. That inability to concentrate. People go, what am I getting, dementia early? Like this
Yes.
focus. People said, I used to be able to memorize everything or remember everybody's names, and now my office is full of sticky notes because I can't remember anything. So we see a lot of memory stuff happening.
Mm,
Um, Hair loss, I start to see that some. Like normally I used to have, this big thick head of hair, and now I'm seeing like my hair is changing. And
mm,
again, that can be multiple factors, whether that's hormone driven, thyroid driven. It's all interconnected. A lot of thyroid dysfunction comes out around this time as well. Women are more likely to be diagnosed with low thyroid or hypothyroid in this perimenopause, menopause state. So there's definitely a connection going on there. Just sleep in general. I hear I'm so exhausted. I have no trouble falling asleep, but then I'm waking up a lot throughout the night. And especially with adrenal dysfunction, we're waking up early,
mm.
so that 4 a.m., 5 a.m., I'm awake. Now I'm thinking about all the things I need to worry about that I didn't do yesterday or that I need to do today, or, where are my kids or what, we just worry about everything. And that is pretty common too, to have that waking up too early. I hear a lot of that.
Yeah. And so I know many of these women will go to their doctors, will report some of those things, the traditional doctors, and they will say, like, here's an antidepressant, well, this
Mhm.
is just a hard time, or let's go put you back on the pill. Um,
Yeah.
or just,
Especially if, sorry to interrupt, but
yeah.
especially if we have irregular periods, which I didn't even
Mhm.
talk about. So, now we're starting to see, whether the timing is different. They're either coming a little sooner, closer together, they're coming farther apart, they're heavier than there used to be. That's a very common thing to see. So, they may be going to GYN or their doctor saying, I'm definitely having some hormone changes, my periods are changing. And
Mhm.
that's a classic reason for the birth control prescription to come out there.
Mhm. To just, and again, it's like a Band-Aid. It's like, okay, now
Oh
at
yeah,
least you'll know you're
yeah.
getting it.
Let's take care of
So
this. Yeah,
how is your approach different? Like, how would, certainly around HRT too. I mean, there's a lot of, negative
yeah.
thinking still that hormones, like, so yeah, how is your approach different? I'll let you answer that, and then I have another question.
Well, and yes, so our approach is to test, so I want to see what's going on, and I definitely do testing. I mentioned earlier I do saliva testing for hormones. That allows us, when you're doing a blood test for hormones, that's kind of getting the leftovers. Hormones are not typically just floating around free in the bloodstream. They have to be bound to proteins. So
Mm,
trying to, filter that out, and then we're getting the venous blood, which is like, I know I'm getting really technical, but if your organs are producing hormones, it goes out into your bloodstream, it hits whatever tissue it's going to hit, and then it goes into the veins to be able to be filtered back out. And so when we're getting a blood from a vein level, then that's oftentimes not actually what the tissues are being exposed to.
yeah, interesting.
So the
Okay.
saliva test is free hormones. They don't have to be bound to anything. It's what your tissues are naturally being exposed to. So it gives us a really nice look.
Mm,
And we look at everything. So we're looking at different types of estrogens. There are 3 estrogens floating around in your body. We look at progesterone, testosterone, DHEA, and then we look at all 4 cortisols: morning, noon, bedtime, or evening and bedtime, so we can really see a nice picture of what's going on. then I can more accurately, I mean, I definitely could guess, based on symptoms, just based on my experience, what's going on. But I think, the person needs to be able to connect and
Mhm.
understand, oh, this makes sense in what I'm experiencing. And then we're going to work on replacing if we need to, or replenishing what hormones may be off,
Mm.
um, balancing if we need to, something that may be higher than it should be, like DHEA oftentimes is elevated, one because of stress, but two because of insulin resistance. So when
Oh.
we're now getting into weight gain and insulin resistant, DHEA goes up, which then filters through estrogen and testosterone. So we
Mhm.
may have higher levels of these guys and lower levels of the progesterone and cortisol. And you might have heard the term estrogen dominance before.
Mhm.
So we can see this imbalance going on here. So testing and then allowing us to replace or replenish. But again, going back to that goal of sort of redefining normal, we've got to kind of replace things that are missing. So maybe we're looking at other things like vitamin D or omegas, the probiotics we're talking about. And then, like you said, going right back to the food, we've got to make sure that we're fueling our body with the good stuff and trying to minimize stressors from what we're eating as well. So that is the same, approach, whether I'm talking to a 35-year-old woman or a 55-year-old woman,
Right.
their hormones are just going to be a little bit different. And
Mm.
so getting into that second question, which is HRT, right? And so we had the big women's health initiative it's been 25 years ago now, where, hormones got a bad rap because they were testing Premarin and Prempro.
Mhm.
And those are not bioidentical hormones. That's pregnant mare's urine is what Premarin came from. And then it added prometrium, which is this synthetic progestin. And so when we're putting chemicals in the body, especially through the mouth that have to go through the liver, and the liver goes, we don't know what this is, so we're going to change it into something that we can, filter through and make sure it doesn't harm us, all these other things come out.
Mhm.
And so we started in that women's health initiative, what they started seeing, particularly in the arm for the Premarin with the progestin, which is a synthetic, again, very mixed up from progesterone, which is bioidentical.
Mhm.
Um, that study showed some concerns for increased risk for breast cancers, strokes, heart attacks, blood clots, things like that. And so then all of a sudden, all the hormones got put under one umbrella. Don't use any hormones. They're bad. They're unsafe. And I have a great colleague who is actually a breast surgeon turned functional medicine like specialist. And I got to hear her speak at a big conference recently, and she just did this amazing presentation on showing, if that were the case and we stopped, prescribing, or
Right.
women stopped taking, these hormones, then we should have seen the incidence
Decline.
or numbers of
Yeah. Oh,
breast
good
cancer
point.
go down. And in fact,
Mhm.
they're still going up, right? Despite
Right.
this fear. And, there is less prescribing of hormones than there was 20 years ago. So that just is one area where, okay, that it really isn't true. And now even the American College of Obstetrics and Gynecology came out recently with a study that shared that really, there aren't those major issues that we were
Yeah.
seeing, that a lot of this follow-up with hormone replacement is not necessarily as bad as what they thought,
Mm.
that we're not seeing an increased risk of breast cancer and heart disease. In fact, women who, particularly women postmenopausal on estrogen replacement, are having less concerns with heart disease. So we're finding more and more that not only are we talking about breast cancer, concern for breast cancer, but that heart disease is still, a top concern for women in terms of death, death causes
Yeah.
for women. And so we've got to protect our hearts too.
Mm.
And to me, testing to see where you are,
Mhm.
replacing what is out of balance, repeat testing to make sure that we're in the place that we feel
Right.
like is a comfortable, safe place. And that's based on studies that we see. Then not only are we doing it individually, but we're doing it safely, we're doing it right, and we're giving you all the best benefits of the hormones without negative effects, right?
Yeah.
And when we can go on, but I also use topical hormones, or some
Mhm.
people get pellets, that kind of thing. When we take hormones, as a pill by mouth, I mentioned this earlier, when it goes through your liver, it metabolizes into the bad guys.
Right.
So that's another area where, some of this concern with the negative effects of hormones are coming from because of how we're delivering it, not necessarily what we're providing. So if we do, hormones the right way by delivering it topically, when you put it on your skin, I'm doing this because a lot of people get creams and we
Right.
compound everything together and they put it on their arm. And we can use much lower doses because it goes directly into the bloodstream. It goes right where it needs to go. And we're not, filtering through the liver and seeing any concerns there. So that's where we really can get some good results from hormones, not just symptom driven, but also preventative for brain health, Alzheimer's,
Yeah.
dementia. I think there's a big connection with Alzheimer's and lack of hormones. Most of the studies are showing that the earlier we can get somebody on hormone replacement, the better outcomes we're seeing. So this is another area. Don't wait for it to get
Yeah.
worse. So progesterone, anti-inflammatory, estrogen and testosterone, both protective from a heart perspective. So, if you can find somebody in your area that's doing bioidentical hormones, I can't say everybody does it exactly the same. There's a lot of different practices out there. That's just one way that I've learned, and I find comforting in doing saliva testing and topical, but everybody does a
Yeah.
little bit different, and that's okay. But it's at least the idea is that we don't have to be afraid of it.
Right.
And even in women who have a history of breast cancer, like again, we're seeing more and more studies that that's not an area that we have to be worried about. Women are getting breast cancer despite hormones, despite other things, because our environment, right? There's so many things going on that are creating these toxins that are causing cancers everywhere, not just breast cancer. So
I mean, that's fast. So just to clarify, because this is how I understand it, but maybe I'm wrong, is that what that 2000, the World Health Study that came out, they were taking estrogen through their mouth, right?
yes,
Versus, okay.
yes,
So that's interesting. And I know people are like, oh, that, estrogen causes breast cancer is sort of their link in their brain. And to start, for listeners, to start unlinking that, our brain
yes,
will get us, we talk a lot about brain anchoring on my podcast and how it'll get an idea and then it just like anchors and holds on to it. And part of
yes,
our job is
forever.
to unattach that. So it is, there are many other ways. Like right now, I'm wearing an estrogen patch, and you're talking about estrogen.
Yes,
There are many
same
other ways
idea.
to get estrogen
Yes,
instead of
yes,
through the mouth. And actually, there, in terms of breast cancer, wine is more of a breast cancer cause than having an so that
yeah. I was
it's
gonna
just
say
interesting,
probably our food that we're eating every
right? Like,
day
yeah.
is probably a higher risk than an estrogen patch or a pellet or a topical cream or something like that, for sure.
So
And going back, I mentioned earlier that we measure 3 different types of estrogens. So we can get really detailed here in the physiology, but there's what we call E1, E2, and E3. And typically E2 is what we've heard about, estradiol. That's what your patch is. That's what, is typically prescribed as estradiol. So what happens is E2 is kind of the workhorse, is what I call it. E1 is the bad guy. E1 is the one that's going to be more concerning, that goes through the metabolic pathways that become carcinogenic. And that can be then connected to genetics, and there can be some concerns there. So we want to keep E1 nice and low. And we actually measure that more just from a safety perspective than anything else, is to make sure E1 is staying low. Then E2, it's got a place, and we want it to be there. There's definitely benefits for brain health, heart health, bone health, all kinds of things. And then E3 is what we call more of a protective hormone. So this came way back in the 1960s, actually. There was a Dr. Henry Lemon who had this thought process: there must be some connection between hormones and breast cancer. So let's just start investigating that and see. So what he did is he took all these women who had breast cancer and he just tested all of them, and let's just see what their numbers look like. And what he found is that the majority of women who had breast cancer, compared to those who didn't, had little to no E3. So that was the initial kind of observation study. And then, of course, everything is studied with mice and other stuff before we get to humans. And so they took mice who had mammary cancers and gave them E3 and saw those cancer tumors decrease. And then that led to human studies showing the physiological like protectiveness of E3 for breast tissue particularly. So in my practice, women don't get estrogen replacement unless they're getting E3 as well as E2. Now, E3 has also been prescribed often in our, kind of functional or integrative world for symptoms of vaginal dryness. So that's also a symptom that we see as we go
Mhm.
through menopause and estrogen goes away, just like we're starting to see sort of thinner skin, wrinkly skin. It's the same thing that happens at the vaginal areas, that tissue gets thinner,
Yeah.
that tissue gets less fat, it gets less collagen, less structure. And that E3, especially provided topically to the area, actually kind of resurfaces that. It
Okay.
gets the thickness back, it brings blood flow back. And so not only is it helping with lubrication, but it's going to be beneficial for that dryness, that atrophic is what we call it, changes that we see, as well as things like incontinence.
Yeah.
So, incontinence is another big one that we start to see as we get older, especially we've had babies, we're staying away from the trampolines when our
Yeah.
kids are ready to jump, right? Or I can't run anymore because I'm
Right.
leaking everywhere. So using vaginal estrogen, and sometimes we see vaginal DHEA used here as well to
Mm.
help support that structure, um, from that perspective of like building us back up again. And that can be really beneficial as well. So we measure all of that, right? We're measuring
Mm.
E1, keep it low. E2, is it in a good place? E3, is it high enough to counterbalance what we're seeing so that we can get all the best results
Mhm.
across the board, with protection from breast health, but also helping support, the vaginal area, which is another big
Right.
concern for women in menopause.
So I know my listener, like some of my listeners are like, what are they even talking about? But some of my listeners are like, okay, so how do we get E3? Is E3
Yeah.
the cream that we are like, I have
Yep.
a vaginal cream that I put on 2 times a week. Is that, I don't even know what it's
It
called.
can't, I don't know the answer to that. It
Right.
depends on
Yeah.
who recommended it and who prescribed it, right? So if it's like a pharmaceutical,
Yeah.
then it's probably E2 because
Okay.
it doesn't exist in the pharmaceutical world. So it's either comes from a compounding pharmacy where we get vaginal E3, and that could be a cream. It could be, sometimes we get it in these little pearls, which are kind of like gummies that you insert
Mhm.
inside that just dissolve. Other pharmacies I've seen actually put it in like little olive oil capsules, kind of like what your fish oil might be.
Yeah.
And again, inserting it inside, letting it dissolve. So there are different ways that you can get E3. There
Hmm.
are some over-the-counter products I've seen that are fine. If they're, again, it's tricky to say where did it come from and what is
Right.
it. So you might want to do some research just to make sure. Again, we're trying to stay away from chemicals. So
Right.
a good product that you feel like it's sourced and they're noticing. We're not putting parabens and
Right.
BPAs and all these things in your ingredients. So I definitely have seen some E3. Estriol is the fancy word for
I
it.
was gonna
So
say, what would my people
yeah,
look for? Like estriol is
they
what
would
it
look for
is.
estriol. They would look for, you know, uh, like there's one that's called For Comfort. There's one that's called To Renew. Comes from I'm assuming I can say company stuff like
Right.
Kajarin,
Hmm.
Kajarn is a great company. I actually carry that in my office. So they
Hmm.
have topical vaginal creams that you can use. Some of these have a little bit of alcohol in the base. So I always say, hey, if you've got chapped lips, right, and you accidentally
Oh,
get
right, right,
alcohol or
right.
something
Yeah.
on it, it may burn a little bit. That's not
Right.
an allergic reaction and you can't use it. Like that's,
Right.
that may happen when we start just because, things are dry. And so you can use it even if it just has that little tinge of a burn in the beginning.
Mhm.
It should, resolve very quickly. And oftentimes, we have people start it once every night for about 3 weeks or so, just to kind of
Mhm.
get those levels up. And then they do something like twice a week, which is what you're talking about.
Okay. Okay. And one more, like, just sort of nuts and bolts question.
Yeah.
So progesterone, you mentioned prometrium, which I know is usually taken orally. I've had some people do it like off label, like vaginal,
Yeah.
but like, how
Yeah.
do you recommend getting progesterone, or how do
So
you get
you
the
can
progesterone?
also get topical cream. So you'll see that all the time. There's they often have balance in them because they're talking about balancing the
Mhm,
estrogen dominance, right? So there's 4 balance, there's 2 restore. There's a
mhm.
lot of companies out there that sell a progesterone cream. They may not say 100% that it's on the label, it's not going to say
Right.
progesterone cream, but it's going to say something. And it's usually sourced from yams. So we've
Right.
heard yam cream or something like
Mhm,
that. And so generally speaking, in order for it to be over the counter, it has to be like below 20 to 25 milligrams. So that's kind of
mhm.
a typical starting dose. Sorry, I'm sitting outside and we got
I can't even.
somebody writing some machine.
Oh,
I
I
don't know if
can't
you
hear
hear it.
it.
It's loud out here. Um, so 20 to 25 milligrams, is kind of a typical starting dose. So that's a safe place to be. I wouldn't go above that without, some testing or something. But, pretty much if you're in your 40s and you're starting to have these symptoms we talk about, your progesterone's low, it's not going to hurt you to consider that. And you want to use it, you want to time it with your cycles if you're still cycling. So
Mhm,
basically, when you're not cycling, you use the progesterone. When you're on your cycle, you don't use it just to
mhm.
mimic what your normal cycle would be. Otherwise, you're just going to create irregular
Yeah,
periods that can be
right,
crazy.
yeah. Oh, well, I really appreciate that. And I guess I had heard maybe progesterone creams don't do enough or something, and so had shied away from them, but that's
And
really
that again, there's all these
like the
misnomers
test.
out there that
Mhm.
there's from again traditional or GYN world, it's like, are you menopausal? Yes or no. Do you have a uterus? Yes or no. And
Yeah,
then then we're going to go this direction. So if you don't have a uterus anymore, there's no need for progesterone, you just
right.
get estrogen. And if
Mhm.
you have a uterus, you need to take a little bit of oral progesterone or prometrium to protect the lining of the uterus to prevent uterine cancer.
Mhm.
Well, we have a lot of cells in our body that need protection from too much estrogen. So it's not just your uterus, but your breast, your brain,
Right.
bones all need that support from the progesterone. So I again, I'm testing, I'm seeing what the levels are, and my patients are going to get what they need whether they have a uterus or not.
Right.
So following up on your question though, is most of the studies are commenting that you need this certain amount of oral progesterone to protect the lining
Okay.
from estrogen. So in my opinion, though, based on my testing and my saliva testing, then there's enough progesterone in your topical cream. But because you're applying it topically, it's going right to the tissues. They don't see it in the blood. So when they
Right.
test blood levels, their progesterone levels are still low according to blood levels as opposed to saliva testing. So it can get a
Right.
little tricky,
Right.
but
Yeah. So
in
what I'm
general,
hearing, yeah.
it's enough to help your symptoms. So,
Yeah.
that I'm not sleeping well, I'm having night sweats, I'm irritable, I have people put it on and they're like, man, that stuff's like liquid gold. I slept like a
Yeah.
baby the first couple nights, right? And you can get that with oral progesterone too. So that obviously has to be a prescription. You can't get that over the counter. Going back to putting a pill in our mouth, progesterone's not as dangerous as estrogen in terms of metabolism. However, 90% of the progesterone you take by mouth turns into something else,
Yeah.
and only 10% of it is progesterone. So if you're taking a 100 milligram capsule of prometrium or progesterone, you're only getting 10 milligrams.
Yeah.
Where if you're taking the topical, you're getting 20, 25, you're already getting a higher dose. It's because it's all delivered instead of having to go through the liver.
Yeah. And so I'm like, listeners, what we need to take away from this is you need a professional to help you. So if we can all work with Dr. Duffy,
That's
awesome.
what I would advise. Yes.
I mean, because it's just like I'm hearing you and I'm like, right. And I'm getting I'm in Australia, so I'm like getting
Yeah.
information to bring to my practitioner. But it is this like again, and I think this is why the discussion is so important because traditional medicine puts it in a couple boxes and is
Yeah.
really looking at symptoms. It's looking at the water coming out of the spout and how do we stop that versus the cause
Yeah.
and
What are those layers that
yeah, what
are
are all
that are
those layers? And then
different?
also just preventative, like
Yeah.
what is happening down the road. So you've spoken a lot about, symptoms, sort of perimenopause, also what we can do when we're in that period. What about the argument for the woman who maybe isn't having, like, she sort of is like, this is fine, I'm good enough, but the more protective argument of taking and having hormones,
Yes.
can you speak?
100%. In my opinion, it is, to me, hormone replacement should be a norm. It should
Yeah.
be, from a preventative standpoint, the more and more studies that we're seeing of, especially for cardiovascular disease, the protective benefits of estrogen and testosterone particularly, which we know go down. Everybody says,
Yeah.
well, isn't menopause natural? Yes, but we
Oh my
also
God,
died
that
when we were 40,
I had a
you
woman's
know?
husband say to her, like, well, isn't this just natural? And he was wearing glasses. And I said to her, I was like, tell her next time that your eyesight declining is natural too. So just try to get through life without your freaking glasses. It's just like,
Exactly. Yeah.
right.
Yeah.
It's like,
I
come
mean,
on.
yes, in the world of we were born, we procreated, and we died, we didn't need hormones anymore, but we figured out how to live longer, right?
Yeah.
So, what happens when we turn 50? All the things that we have to do. We got to now you have to have a colonoscopy, and you have to have your mammograms, and you have to have all the screening things, right? Because at age 50, our hormones go away. And
Yeah.
all the risks of all these,
Oh, wow.
diseases start coming
Mhm.
up. And of course, again, there's multiple layers to our lifestyle, our diets, our, genetics, all that kind of stuff too. But there's a huge part of it in hormones going away. And so absolutely, um, to me, my mom is on hormone replacement, my
Mhm.
aunts are on hormone replacement. I take progesterone myself, and
Mhm.
I'm not there yet, but
Yeah.
I will be, and I'll definitely be on it. So,
Mhm.
that's what I love about these platforms is we have to get the word out. We have to do it through education and understanding, because the traditional approach, unfortunately, and it's not doctors are bad by any means, they just
Right.
don't have time. You know,
Mhm.
they don't have time to learn, and they don't have time to go through these steps and help the patients to understand what they can do differently. So that's what I'm all about is I don't need all your listeners to be my patients. I'm happy to take phone calls for South Carolina, North Carolina area, but um you know there I go to a conference every year in December called A4M, which is like the Association for the Anti-Aging Medicine or something like that. And there's a lot of hormone driven conversations there. And this is a huge conference. It's in Las Vegas in the big convention center.
Yeah.
There's like thousands of doctors there. So my
Wow.
point with that is that we're just a drop in the ocean of all the doctors, but there are doctors out there. So, if you can find somebody who's doing bioidentical hormones, functional or integrative medicine, they're likely going to know about it. So, if you want to start searching, is there a doctor in my area that, is going to be knowledgeable about this, then those are your keywords that you're
Those are
looking for.
keywords. Yeah, I will
Um,
put that stuff in the show notes, listeners, and I'll also have Dr.
yeah,
Duffy's information herself because what I just am hearing and through my own life experience has been that I need to be an advocate for myself. So not only, you spoke to like why are
yes,
doctors not doing this? Sure, they don't have time, but also what I find interesting is if they're, were trained in the last 20 years, they were trained in a period when they had that research that hormones were quote
yes,
unquote bad too. And so
yes.
they are offering possibly the, pill and the, just suck it up type prescription because of either,
What's so
this
scary
is
is
their
birth
forte.
control pills have
I
higher
know.
levels of the hormones than these hormone replacement things we're all saying are bad.
I know. Isn't that
And there's
fascinating?
so many women in this like 40 to 50 age that are getting put back on birth control.
Mhm.
Obviously not for contraception, they don't need it anymore, but because of, irregular periods and things like that, or women that are getting IUDs all the time. I see that all the time. And IUDs are a little bit less concerning because it's progesterone only, but it's still progestin, it's a synthetic. Um,
Mhm.
so yes, yeah, going back to your statement though, is educate yourself, learn that there's a different way of doing it, and advocate and search. Then don't take this is normal, as an answer,
Mhm.
because you shouldn't have to feel bad. You should feel great. You
Mhm.
should feel, this is a great time in our lives when our kids are, yes, they may be driving us crazy, but they're also not stuck to us and,
Right. Yeah,
that
exactly.
needy, and like we get a little bit of independence, right? We should feel great. We should be at, our optimal physical shape, and, great in our
Mhm.
relationships, great in our careers, whatever's going on. Um,
I
don't
mean,
wait
yeah,
till you're retired to slow down and, be
right.
able to catch up. Like, you want to live your life.
Yeah, I mean,
Slow down.
this show is the Love Your Life show. So I want people to
Yeah.
love their lives. And I think what I want listeners to hear is from you that, first of all, just because someone tells you it's normal or it's okay and, suck it up, like that, no, let's put our foot down and say no to that. Also, the whole protective piece of,
Yes.
my symptoms have not been so bad, but I'm on hormone replacement because I want, I can't see what's happening to my bones. I can't, and I
Right.
even if actually I can get scans and everything's fine. It's like, I know what's happening in the dynamic tissues of my
Yeah.
body. And to just, I know a lot of my listeners are
And
those
that,
proactive.
yeah, we didn't dabble in bone health, but by the
Right.
time you're osteopenic or osteoporosis,
Yeah.
it's way too late.
Yeah.
You
I
can't
mean,
get a lot of that back. So,
yeah,
that's
that's my
another
main
area of
reason.
prevention for sure. Yeah.
I've said bone health and bone health, brain health, and heart health are
Yep.
why, my main
Yes.
things. And then, yeah, it's nice to not have night sweats.
Yeah.
But yeah.
It's
Oh,
nice to
thank
feel
you.
good too, but yes, absolutely. So there's again that control a symptom, if you want to call it, approach, but there's that, are we doing everything right? Are we getting everything balanced and in the right place so that our bodies can do what it's supposed to do?
Yeah.
That's really what it's all about. And then, if our body feels good, then our brain's going to feel good, and it's all going to work itself out,
It's
and we're
all
going to all live
related.
forever. That's the
Yeah.
whole anti-aging thing is, I mean, we want to be running around. My grandma was kayaking in her 80s, I mean, I just, you know, we want to enjoy that time. We've worked really hard, had our careers and our kids and, even maybe taking care of our parents like you talked about. And so,
Yeah.
if we're having grandbabies too, I mean, how many patients do I see all the time that are like, I'm too tired, I can't keep up with them. I want to
Mhm.
babysit and I want to keep them at my house over the weekend. And by the time it's, I'm like, oh, I can't do
Yeah.
that.
Too creaky, too tired, too all of it. Yeah, no, thank you so much. This has been so inspiring and very informational for me. I love it. This is, listeners, you're going to find show notes at smbwell.com/309. And I will have all the ways to connect with Dr. Duffy in there. So you work with people, obviously you're in South Carolina, so in person you have your practice. Do you also do any
Yes.
telehealth or?
We do telehealth. However, if we're, I mean, part of that is prescribing hormones. And so, we still need to be within the state. So the
Okay.
rules that I'm licensed in South Carolina and North Carolina. So we can see patients telehealth, but then we are still required to see them physically once a year.
Mhm.
So if you are from far, far away and you want to fly in, like
Right.
come see me, it's just a
Fun.
one-stop shop. We can do everything there. And then, yes, then we can continue everything, virtually if needed. So,
Yeah, and I'm like,
I'm
watch
happy
this
to see
video on
anybody from
YouTube because
anywhere.
look at her background. It could be a very nice vacation for
Very
herself.
pretty.
Very nice. And if nothing else, getting a consult with you and then feeling more armed in as to what to ask your doctors and to go in as an
Yes,
advocate. It would be a very
for sure.
educational experience. Plus, you have a book. So, I mean, all of it. I will put it in the show notes. Thank you
Yep,
so much for taking your time and
absolutely.
helping us all here as we are trying to, really thrive as we move into
Well,
this.
thank you for having the platform that lets people, get to know a little bit more about what's going on with them in their life, and so that we can educate and advocate and, live the best life we can. That's awesome.
Awesome. Thank you, Dr. Duffy.